The whole country was really thrust into a different world in March. And we know that for many students, that final couple months of school was very difficult. And in fact, less than a quarter schools had any expectation of kids actually learning anything new after mid-March. Through the summer months, we know that there was planning and discussion going on about reopening and ensuring that kids could begin their learning again. But what we're seeing right now is still an uneven application of opportunity for students. And we have parents who are unhappy with schools where their children aren't being permitted to go back to school and learning in person, and others that are concerned about it and fearful of it. And we have districts that are not opening up at all to in-person learning and giving families no choices and no options. And so it's been a very, very disruptive time, we know, for families, a frustrating time, a concerning time. But we are seeing a lot of bright spots as well. We're seeing a lot of families who have sort of decided to take things into their own hands and have started homeschool consortiums with other families, or micro schools, or some of these little one-room schoolhouse type approaches. But we know at the bottom line, there are too many kids, particularly the most vulnerable, who are not having a full education experience, a full learning experience as of this fall, and are still falling farther and farther behind. So it is a real moment of crisis and opportunity for education in America.
Wow, I know that your administration has put a lot of emphasis on the idea of getting kids back in school in person. And you may know of the work of Emily Oster. She's an economist at Brown University, and she's actually created a national COVID-19 school dashboard to measure what has been the infection rate. And, on an independent basis, they've surveyed almost 1,300 schools, more than 200,000 students who are in school in person, 64,000 teachers and staff. And they've come to the conclusion that schools, despite all of the fears of if we send back kids too quickly, that schools have actually not been any kind of virus super spreader. In fact, her data says something like 0.13%, like 1 in 1,000 students are being infected. How do you process that information? Because most parents don't have a sense that that's what the actual infection rate has been.
Right. Well, I think there's been a lot of latitude and a lot of obfuscating of facts for different ends and different agendas. And the unfortunate thing in all of this is that the children who aren't able to get back to school in person, their learning is suffering as a result. And I think where schools have been very intentional about engaging their families, talking very openly about their plans to get kids back in school, to give families who have concerns because of some health condition in their own family the option of learning at a distance, and then continuing to communicate with those families about how to mitigate a problem if there is a diagnosis occurring in the school. And I've visited a number of them in Georgia and in North Carolina, and most recently in Phoenix and in Texas. And there are people figuring this out, and leaders that are doing what needs to be done to ensure that kids can continue their learning. We have got to get through the part of fear and get to a place of in a posture of will to ensure that all kids get back to learning, because we know for kids across the board, there are other health risks to not being back to school. Absolutely. Learning in person. There's social and emotional growth, and there's mental health risks. And that's even, not even to talk then about the academic health and lack of progress that too many kids are experiencing now.